All right, I have a question for you.
Yeah.
What's your take on the soft nursing era? Because personally, for me, I really like this direction of where, nurses are going as far as like prioritizing themselves, having boundaries, right? Like as it relates to their nursing career and their health and, everything else as it relates to holistic wellness. So I'm curious to get your take on the soft nursing era that we've been seeing over social media.
So two things. First and foremost, I am in my soft nurse era. Like I left bedside, I left the stressful environment. I absolutely love it. The day that I left, I felt my shoulders relaxing, my jaws relaxing. I felt like the stress was lifting and melting off my shoulders. And I love the fact that I was able to have that opportunity. It's unfortunate that other people are not able to be afforded those opportunities that I've been able to. The second piece, though, is it has created this environment, at least in the region that I'm in, where all of the experience, all of the people who are valuable and good nurses are now leaving bedside. So now we have this overflowing amount of new grads who don't get great preceptors, who don't get good training. So it's dangerous for the patients. But I love the fact that, like you're saying, nurses are able to put their boundaries and recognize when it's not going to be a more enriching space and it's no longer serving them. And I think media has done a great job too of making a lot of problems known of the nursing environment ever since COVID, really, of how unsafe staffing ratios can really detrimentally affect patient outcomes and how chronic stress has led to people leaving bedside significantly earlier in their careers prior to they used to. And now, I'm sure you've seen we have this issue of there's physical violence in the workplace, and that's a very common thing, and nurses are becoming aware that hospitals don't care. Your unions will not protect you, and you have to get out of that system. It's not enriching, it's not worth it.
Totally. And I love that there's like this stance now. And I think a lot of people say that social media is like a bad thing, but I feel like with the movement that we're seeing within for nurses and healthcare professionals, I love it personally. And that's why I do what I do with Team VP Fit as far as really helping our nurses understand that there is life outside of your work. And, to a detriment, like nurses like yourself, you guys are so giving. You guys went into this field to make an impact. So I'm curious, you've been in bedside for how many years have you been bedside? Can you share with us some of your experience as you jumped in? Like what were some of the maybe the health consequences that you weren't mentioned or warned maybe your first year? Because we do have a lot of nurses who are they just graduate. They're in 1 year, 2 year, right? Everyone's grinding. They want to make an impact. They want to grow. They want to make a great career. But like, can you share with us some of your experiences? I'm curious to know.
Bedside right at the 3 year mark. So I was in critical care the entirety of my experience. And what nursing school does is it creates this perfect, flawless healthcare system where, as the nurse, we come in and we're integrative with trying to be transformational with patient care, but then advocating between different interdisciplinary teams. And that process, the way that it's perceived to us in nursing school, is seamless, it's smooth, it's not complicated. But in reality, it is so unfortunate to say, but healthcare is only trying to make a profit, and they do not care about anything but being as profitable as possible. And so that means that your manager might say, hey, instead of getting one very sick patient that, according to California laws, would require us to have one nurse to one patient in this situation, you're actually going to have two types of these patients because we don't want to pay for a whole extra 12-hour shift nurse to be there. And so that chronic fatigue, that chronic stress, that chronic frustration of being in this very complicated network, it caused me to lose a lot of weight. I also lost a lot of hair. It felt like I wasn't able to have normal days off where I would have headaches for like 2 days straight after a shift. I wasn't able to have normal sleep because I was having nightmares of forgetting to do something or when I would have a patient who would die. It was just areas that were so many areas that were negatively impacted by my job that no one in my nursing school path talked to me about, warned me about. And mind you, I worked in the hospital as a nursing assistant so that I had a foot in the door. And even then, even when you're in that hospital environment, you really don't quite get to understand until you're in the role. So that was harsh. That was a rough transition for sure.
Oh, and I love that you're speaking out on this because I'm sure there are thousands like of nurses going through what you're going through right now, right? That care to patient ratio, it just doesn't make sense, right? And it comes back to the profitability of these hospitals. Now, as you were noticing these things, like, what did you try? Did you speak to some of the nurses that have been working there? I hear the coin all the time that nurses like feed on their young. Like, is that legit? Is that real? Like, I'm curious as you're going through these symptoms, I would be like, oh my gosh, what's going on? Is this normal? What were you doing at that time?
Fortunately, I was able to be in a primarily supportive environment where
That's awesome.
it was a younger crowd. It was this newer generation where we're not facing these like dinosaur nurses who want to feed off their young. But they were still definitely present, and there were still definitely many moments where, you're getting pushback and you're getting this like, I don't want to say bullying, but this establishment of normalcy of what we're going through of, yeah, that's just, it comes with the job. And, everyone talks about it, but no one's doing anything about it. And it wasn't until probably the very end when I was thinking about leaving bedside that I started to communicate my feelings, my frustrations with my team. And a lot of us actually ended up leaving at the same time because we mutually agreed this is not worth it. We're not getting paid enough to be exposed to these stressors and these dangers of the job. And so there was actually a huge mass exodus on my unit where over 40 nurses left because we were done. We wanted change. We didn't want to be exposed to the stress, and we were just done.
That's crazy. When did you realize, you also have your CPT as well, which is super awesome. When did you start prioritizing your health and wellness as you were noticing this is what it's just going to be? And I had to it's almost like you took it upon yourself to do something versus sitting there and letting this, you're just stuck you into this hole.
If anything, that's when I noticed, and that's when I made that decision to leave because I always prioritized my health. I always was able to be effective with my workout routine. I was always able to meal prep, and I felt like that was just a strong strategy that I had for myself to prioritize my own wellness. And toward the end, when I would have so much neck and back pain and so much of a migraine because of stress and dehydration from the shift before, that I couldn't work out, that I didn't want to meal prep, that I didn't even want to eat because my headache was so bad. That's when I was like, yeah, this is no longer serving me. I need to leave.
Dang. And how did that impact you, not just within your ability to show up and do your best, but what about like life outside of nursing, your family, like your relationships? Like, how did that affect all that?
I talk about this a lot, like with my grandparents, who they were primarily the childcare that were able to support me on my longer shifts. And I would come to their house after work and they would have a plate of food ready for me and they would want to talk about my shift and they would want to just be like, Mija, how are you? Like, and I was a numb, quiet, cold zombie. I didn't want to eat. I didn't want to talk with them. And I adore my grandparents. They're my soulmates. They're my best friends. And then I didn't want to, be a very present, and I didn't have the capacity to feel like I was a fulfilling mother. I was, very lacking with getting my son's homework done, packing him healthy snacks. Parts of me were being taken away that I never wanted to give up. And that's when I was thinking, I need to go. And it was actually my partner that was like, I am sick of you coming home and being this way. I'm sick of you coming home and crying in the shower, crying in bed. Like, you need to leave. And so it was truly when the people outside of, other than myself, that were noticing these negative changes and were like, Lauren, you need to think about a different position.
And I can imagine you being a mom at the same time. I mean, you seem like you value your family, like family is a big value for you. And you also really value growth and your
Yes.
career, and being a nurse is your identity. how did it feel to have so much pressure? Because, I work with a lot of nurses who are moms who want to be the best wife or husband. They also want to be the most amazing nurse for their colleagues and for their patients. And they also want to be a role model for their kids. I mean, it's so much pressure. I'm not a parent, I'm not a dad myself yet, but I can imagine the pressure that you must have in that moment when your partner's like, Lauren, like, something needs to change.
I was kind of used to the pressure because in nursing school, I always worked full time. I was a single mom. And so, if anything, I saw coming into my ICU career as this is my dream job. I'm doing what I want to do. Like you're saying, I'm fulfilling my passion and I'm able to be a great nurse and make positive impact on my patients' lives. And if anything, it was in that where to me, I hate to admit this, but it's the truth. It still was not worth it. I would
Mm.
have 9 great experiences with patients where, they leave the hospital, they get to go on with their lives. And I was part of a team that saved them essentially. But having that 10th patient who was extremely stressful or extremely rude, I would be like spit at, grabbed in the crotch. I even got kicked in the chest one time from like this older patient. And it was through all of those experiences where it's just like, again, it's just still not worth it. And if anything, the pressure then shifted where I needed to find a job that was going to allow me to still have the work-life balance that I wanted because I loved working 312s and having 4 days off.
Mhm.
And I didn't want to work like in some desk job, doing case management or filing. I would hate that. So if anything, the pressure was finding a new position that was going to still fulfill me as an individual, but still be able to provide and have work-life balance.
That's awesome. I love that you kind of saw a different path that still allowed you to do your passion, but not be in this position, just that you have to sacrifice and you can have both. And I love that you're a prime example of that. I'm curious, what are some of the like biggest struggles that nurses face, in the ICU, who are med surge, working, bedside, first couple years into their role? Like, what do you notice with some of their biggest struggles?
As far as from the nursing point exclusively, definitely time management, especially in the ICU. We have to do things on an hourly basis, which for most people would think, oh, I have an hour to do something, but you have to split that between 2 very sick patients while managing tasks in between. And on my floor, we had a very strict schedule that we had to adhere to. And if we deviated from that schedule, even if we were late by a single minute on that hourly timer, you would have a nurse practitioner breathing down your neck. You would have a surgeon yelling at you, harassing you. And anybody who works in ICU can attest to what I'm saying. But it truly is a very 24/7, 100% of the time you're in a high stress environment. So being able to differentiate what do I need to do first and then second, because if you do the thing that you need to do first, second, and the second thing first, it's going to screw up your whole shift. You'll be thrown off. And then you're sprinting for your life the rest of the shift to get back on schedule. And then the second thing, kind of piggybacking off of what I already said, is that prioritization, understanding what's going to kill your patient first, what can I delegate to somebody else, but what do I need to do first and foremost, even though I have 2 patients who are actively dying, who do I need to
Mm.
save first? And so establishing that appropriate prioritization is definitely a challenge. And in nursing school, it's very black and white, but in the real world, there's a lot of gray area.
Wow. Yeah. I feel like it's so nuanced to kind of have that skill and to have that urgency and also and that's why I'm so big on health and fitness, because I'm not a nurse personally, but me, coaching nurses for the past 3 years and really diving myself into the field. I'm like, I always say, nurses, you guys are going to war, especially if you're in the ICU. Like, you guys are going to war every day. And so like, it's almost like you got to be on right when you get in until you get out. I mean, from a making these very quick decisions that have to be strategic because there's someone's life on the line. You're not sitting back working from home, filing paper, right? This is like real people on the line. Like, what do you notice with their health and their fitness? And do you see fit nurses, you know, doing better at their job versus the nurses that are coming in, not nourished, not sleeping well? drinking Cokes and eating a lot of sugar. Like, do you notice a difference from your experience with the nurses who do prioritize their health versus the ones who might not be?
I actually do. I can specifically think of 3 nurses on my unit who would always meal prep. They would never order food with us. They never drank any of the
Mm.
sugary drinks. They were very muscular. They would work out either before or after the shifts. And they were the 3 strongest nurses that we had on the unit. We called them, like doctor, whatever their name was, even though they weren't doctors, they were nurses, but they ran the floor essentially. And they would walk, or they would what am I trying to say? They would run circles around us other nurses who, weren't as experienced as them. And it just definitely set a precedence of a different type of caliber of expectation. When you're working in the ICU, it really required you to not only care about your patient population and work hard on your shifts, but also prioritize yourself. Because if you can't perform outside of work, that will show on your shifts. And it really did, at least in the experience that I had working on my floor, for sure.
Oh my gosh, yeah, that's really cool to hear. I mean, it seems like it's a big difference from the fit nurses because you said they were running laps around, other nurses. I'm curious, like for you, you're super busy. You not only are you working, you're also a mom. What are some, tips and tricks around nutrition and workouts that most nurses fail to do? I'm really curious to get your take on this.
Say my biggest tip is nutrition honestly takes precedence over your staying active. And I only say that because, at least in my job, we're averaging probably about 13,000 to 15, even 18,000 steps in one single shift. And, lifting patients who are twice my size, twice my height. And if you're not properly fueling your body, meaning, meal prepping for your shift and having an adequate breakfast and then an even better lunch to carry you throughout your day, that really is going to cause you to suffer. And I can recall having shifts where I would work 3 12s in a row. And on my third shift, I just didn't have enough food that I meal prepped. And I would suffer through that shift. I was starving in the morning, and I would try to just grab whatever I could. And, the banana and the coffee is not going to get you 8 hours into a shift. And, you then have a headache and then you're feeling dehydrated. It all just is this domino effect. And so absolutely prioritizing nutrition. But also too, there's science that shows that when you're under great deals of stress, you lose a lot of magnesium and glutathione. And so if you're not eating the foods that are high in those electrolytes, you're going to feel it. You're going to have muscle cramps, you're going to have headaches, eye strain, dry skin, all of these things. And that would be my first thing as far as advice for people who are trying to get into this world of taking better care of themselves is learn what works for you and learn what you need to do in order to eat healthy based off of your goals, because that will show and that will absolutely pay off during your shifts and outside of work as well.
Totally. That's why the first thing that when nurses come in to work with us, the first 4 weeks, we're like, we are not talking about any working out at all until we get your nutrition and reduce your inflammation. And we teach you and you have a consistency around that. It doesn't matter what you do with your workouts. You don't even have the energy to work out. Like the last thing you should be doing is working out. And I like the fact that you mentioned, the magnesium and the minerals, because what I've seen is that, first of all, the big issue is that nurses aren't sleeping, especially if they're working 3 12s and they work nights. It's difficult, right? I totally get that. Number two, they're not hydrated or they're not even eating whole natural foods. So the issue is that they're eating a ton of ultra processed foods, all the break room snacks, right? The quick go, the breakfast sandwich from Starbucks, and then they're slamming that with caffeine. Caffeine is a diuretic. So they're even draining themselves more of these minerals, sodium, magnesium, potassium, and they wonder why, right? You're like a couple hours into your shift, you're like, why do I have a headache right now? Why do I feel like I need another caffeine boost? And then they almost do more caffeine, not realizing that they're digging themselves in a hole of inflammation, burnout, physical, mental exhaustion. And so I love the fact that you mentioned nutrition is so important, something that you prioritize first for yourself and what you would recommend for nurses.
Yeah, there was even towards my last couple of shifts before I had actually gone on a short medical leave,
Hmm.
I was chronically dehydrated from my shifts that I started to develop like UTIs, and then that prolonged and I actually developed a kidney stone. And so I had to have that surgically removed. So it really just goes to show how crucial and how detrimental these choices, these nutritional choices really can impact you. And, I still am like recovering from that procedure because it took like a huge hit on my health. And so, I try to share that with my clients as well and with future nurses because they don't understand until it's too late.
I love that you share that, and thanks for sharing that, Lauren, because I'm trying to get my clients and our clients to just drink more water. And I feel like everyone knows they need to drink more water, but I'm like, nurses, y'all need water because, I mean, just take you for an example. So I appreciate you sharing that. And, as we're on nutrition, I get really excited about this topic because it's, I think it is the cornerstone. I truly believe it's 80% diet and 20% of, the training aspect. I mean, I hear so many nurses are cutting their carbs, like super low carbs. They're trying like fasting. They'll do like a lot of juice cleanse, which is, I'm like, that's the worst thing you can probably do with if you're working the ICU nurse or you're working 12s. Like, what are some of the other maybe diets that you've tried from your experience or other diets that you hear that your nurses are like, in the break room saying, hey, I'm trying this diet, I'm doing this, or I'm doing that. Like, what are some of the diets or nutrition stuff that you're hearing or maybe that you've tried that you would love to share?
I think one thing that I hear more often than I'd like to is like you're saying, you're in the break room, a doctor or a family member brought in donuts or bagels or candy. And, again, you're not able to get a break for 8 hours, even to like go to the bathroom or get a drink of water. And when they're finally able to get into the break room, they're seeing this, terrible food option. And out loud, they say, better the donut than nothing, better the this than nothing. When it takes you, 10 minutes to go downstairs to the cafeteria, come back upstairs and have a Greek yogurt or a hard boiled egg or, anything but that highly processed, ultra stuffed with sugar, just a terrible food option. And it's just really unfortunate. And they're really not understanding just how not optimal that decision is. But the other thing that I've noticed too, and you briefly mentioned it, is this fad around, oh, gotta get my protein in, gotta get my protein in. And they're drinking this like terrible protein shake that has nothing but like corn solids in it. And it's like, like for sure, prioritize your protein, but that is filled with crap and filler. It's better to be gearing towards a whole food nutrition. And, don't get me wrong. I understand, vending machines, cafeterias don't have the most optimal choices, but being aware, or rather not being aware of what it means to have this like high protein, low calorie drink option is actually not as good for you than you think. It might actually spike your blood sugar higher than you're understanding.
Totally. I think, the whole food is something that we always try to push our clients to do, especially our nurses. And I understand the environment. The hospital environment is not set up for success for nurses. I mean, you go to the cafeterias, you look at the vending machines. I mean, you mentioned doctors are bringing in donuts and going, hey, it's better to have a donut than have nothing. And when you're like a couple hours in and you're stressed out and you have two patients that like are on life on the line, you're the donut seems it seems great. I mean,
Absolutely.
I would probably eat the donut. And it's like, but what nurses aren't understanding are what are the unintended consequences that we're not thinking about or you're not thinking about. Okay, cool. A bite of a donut won't hurt. Just like what I said, a pizza won't make you fat, just like eating a salad won't make you fit. But what about when you do 2-3 years of biting that donut every single time at
Mhm.
work? What are those consequences? And are they
Absolutely.
worth it? I don't think a lot of nurses are thinking that far. And so that's why I get really passionate about this is because if they knew where they would be in the next couple of years, they would probably make the better decision. Right.
And then even on the opposite end of that spectrum, understanding that it is okay to have that donut. Indulge by all means,
Totally.
but pair that with, a whole food high protein, some fats in there with some fruit, understanding that there is such thing as balance and you can have the best of both worlds, but it's this misconception of having this extremist mentality where you're
Mm,
never going to be allowed to eat a donut ever again. And it's like, no, you could probably on one shift a week have a donut, but make sure that on your second and third shift, you're not doing that. And also that you're prioritizing your health for every other meal of that day. And so, again, just trying to really get nurses to understand that balance is possible. And that, like you're saying, that one donut in the break room isn't going to make you fat, but it's understanding what that also requires you to do outside of that as well.
Totally. And then correct me if I'm wrong. I think another big challenge that nurses face is their mindset. I feel like for some reason nurses have this perfectionist mindset of it's either I'm 100% and if I just miss one thing, I'm done. And like I'm gonna throw in the towel and it's just like go crazy. Like, can you
For sure.
speak to that? Like, where is that coming? Is that because of like through nursing school and like just like the career itself, which is developing that mindset? Because we're really working with our nurses to how to break that perfectionist mindset because it's really holding them back from being fit for life and to do this sustainably. So I got to get your take on this.
I think the only mentality piece where I can think that comes from is throughout your 12-hour shift, especially if you're a good nurse. And fortunately, I was able to work with a lot of fantastic nurses who worked hard and their patients, you could see that in the patient's outcomes. And
Mm-hmm.
so you get this immediate satisfaction of, cool, I worked hard and here's the outcome.
Mm.
And we all know that with working out, with trying to establish a better fitness routine or nutrition routine, you are not in it for the short haul. It is definitely in it for the long haul. And so trying to see that immediate result or immediate satisfaction, if we're not seeing inches coming off of our waist, if we're not seeing like our shoulders developing or feeling better, it's you're naturally would get frustrated. I know I have definitely, as I've gone through different seasons of my life where right now I would say I'm like definitely on the skinnier side. And I used to be able to like work out and eat and I would gain weight and I would have this like beautiful stature. And so, because I've been busier, I haven't been able to get that immediate satisfaction. And so I've seen that mentality with my colleagues as well, where we don't get that immediate result. And so then that deviates to, well, maybe I need to do a liver detox. Maybe it's because my
Mm.
liver isn't allowing me to get rid of this, or maybe it's because I have high cortisol. So now I have to get on all of these hormone balancing supplements. And it's like, no, no, no. Keep doing what you're doing. You might actually be gaining muscle and losing fat. So the number on the scale isn't changing, but your body fat composition definitely is. And maybe you're not, looking better in the mirror, but you're feeling better on the inside, you're performing better at work. So it's this mind shift change of what it means to have transformation, what healthy means to somebody, and to allow you as a nurse, despite this perfectionism mentality, to understand that it's going to be a while before you actually see long-term results, and not to get frustrated with this journey.
Totally. And I love that you speak on that. I think nurses definitely have to give themselves more grace, especially our female nurses who are over 30. And, I like to blame, the fitness industry for this. I'm in the fitness industry, but, I hate the fitness industry for decades. We've been telling our women to be small, to be skinny, to fit into clothes. And that's so far from the truth as far as what a healthy, person is. And so, I love that you're saying it is going to take a long time. Yes, you might not see the change in a week or in 30 days. And yes, you might see other, women on social media or even in the workplace being more fit and healthy, but that doesn't mean you're not becoming more fit. That doesn't mean you're not doing the right thing. And that's not where you should be. And I love that you mentioned you went through seasons and right now you might not be your prime as far as your aesthetics. I'm not as well, but we've been working out. We're in this for the long term. And so we
Yes.
understand, okay, it's okay if we're not the most fit right now. I used to be shredded and I used to be strong, but I'm like, you know what? Life is seasons to that. When did it click for you that you're like, you know what? Like right now, I just, did my master's. Like I'm probably not going to be in the gym 5 days a week. Like when did that click for you to just be in the process and be in the journey and not beat yourself down for not being your prime with your fitness?
Probably 2 semesters ago. So that would have been right during like the holiday season, of course. And I'm psycho. I decided to start a business, even though I already have a business, and I'm also in school, and I'm also working, and I'm also a mom. And I've had this happen many times to me before where I have to realize just how much I've put on my plate. And yes, I have 4 days off, but those 4 days are stacked with things and tasks that I've put on myself. And that's to no one's fault but my own. But to not even put fault on my own, to not even blame
Yeah.
fault, just understanding that sometimes my number one priority is to get my physique better. And sometimes my number one priority is to get my business up and running, or to get better at my job, or to focus on my son, because during that time he was also off school. So I wasn't able to have care for the gym. And so I've been able to truly enter this mentality space, I guess you could say, of giving myself grace, and knowing that I am loved regardless of how I look, and that I bring value despite what my physique looks like. And, I know that I have the tools in my toolbox to get me back to where I want to be
Yeah.
physically, but also I have the experience and I have the knowledge where I have come from a space of being a little more on the leaner side and a little bit on the skinnier side. And I will bulk up. I will, have my peach booty by the summer. Like, it's going to happen. I have to realize that right now it's not my number one priority, and I'll get to it when I get to it. And even now, after I've graduated, I'm still just as busy. So it's kind of creeping up there. But again, giving myself grace that I'm facing different challenges and I'm trying to work on other aspects of my life right now.
That's amazing. It's inspiring to hear from you. I was in Austin not too long ago with, networking with other health coaches, and some of the most successful health coaches were actually moms of two, moms of three. And there was nothing more inspiring to see, women just like you who are working, starting businesses, being a mom, and still having grace to prioritize your health and your fitness. And so, I just want to say, you're definitely inspiring, and I hope this definitely hits, someone out there who needs to hear this. And I also love that, through your content, and through your social media, you always, praise God. And then that's something that is I think is very powerful. Personally, for me, I'm starting to get into my spiritual, my faith. I want to give a shout out to my girlfriend Tia for really kind of bringing me into that, and
Yes.
really understand the importance of that. I'm curious, like, how has that helped you navigate all of these challenges and continue to kind of help you propel into who you're destined to be?
Man, if anything, that is the sole entirety of who I am now because of that destiny that God has set out for me. Very briefly, when you go to my page, you see this one post that's pinned where you can see my son in the hospital. And it was actually when I was pregnant with him. I was in nursing school. I gave birth to him prematurely, and he was extremely sick. When he was born, he wasn't breathing. He needed to have CPR, and he needed to be taken to a NICU hours away because he was just very critical and basically, on the brink of death. And because I was able to survive my postpartum complications, because my son was able to survive his NICU stay, and because I've been able to have the family support to get me through nursing school and essentially be where I am today, it's because I feel that destiny. I survive all of these things in order to be where I am today. And so I need to take advantage of the opportunity that God had given me to show other people that it can be done, that it is possible, despite any, things in your past that want to hold you back or that might strike fear of moving forward. To me, I have no excuse. If I've been able to survive that, if my son was able to survive that, I can honestly survive anything, and I have nothing but God to thank for that. So that has essentially like the trajectory that I'm on. And my son being born, that whole experience was a catalyst to enable me to create this life that I've created today.
That's amazing to hear. And, I think it's inspiring. I think the lesson here that we can all take away, and something I'm taking away, is that we're made not of our successes, not of our wins, but how we move when we do run into those things, because life is bound to happen. Right. And I have a tattoo on my leg, and it says the worst is yet to come, because I'm almost prepared. Like, the things we do, it's like there will be more like of these things, right, in our lives. And if we're able to kind of be grounded, really focus on what really matters to us, our priorities, we would be able to have the strength to go through it. So truly, truly amazing story there. And yeah, I mean, I guess to kind of bring it back to a little bit, about fitness, like nutrition is a key part, of you. So now in your situation, now let's wrap up. People want to know, like, okay, how are you balancing everything? You have your master's, you're a mom, you're starting business, you're doing social media. I mean, you're on this doing a freaking interview podcast. What's your secret? What's your secret, Lauren? We got to know. How are you balancing everything? What's the secret?
Honestly, I don't know why I am made the way that I am. I have always been an extremely ambitious person. I don't know how to relax. I don't know how to have a day off. I really do get pleasure and enjoyment out of being productive so simply, and it's so cheesy, but even as simple as every single week making a detailed to-do list of what I'm going to do every day to get the things done that I need to,
Mm.
that has been essential in not just now, with having my master's and my business, but that's how I got through nursing school, balancing all of the things. So just being very strategic with where I'm putting my efforts, but also too, knowing what I have to do to sprinkle in what I need to recharge my battery. When Brian is home, he's a firefighter, so he has very long days, and there's many days where he's not home, during the daytime or the nighttime. So when he's home, I really do allow myself to put on pause what I can put on pause and spend time with him. Because if I feel like we don't get that connection time, it sucks. I hate it. You want to spend time with your
Right.
partner, happiness and fulfillment. Same thing with my son. I can't be behind my phone, behind my computer when he's around. Being able to actually play with him and talk with him and watch him grow up too. It has been able to, same thing, like, fill up my tank. And so in this beautiful journey and this like art of balance, it really has to be honed in on what do I have to do today to get things done? What takes priority? And then what do I need to do to focus on me so that I can move forward tomorrow and be effective throughout my day? So yeah, I don't know. It's hard to like pinpoint it because I just simply am the way that I am. So hard to answer that
Yeah.
one for sure.
No, I love that you're just being transparent. It's like, there's nothing wrong with wanting to be productive and loving that productivity. I think that's a great, you know, strength of yours. But you're also reminding yourself, hey, let me not forget to connect, with my partner, with my son, because that's your why, right? At the end of
Mhm.
the day is like who we're doing it for.
Yes.
And so I love that. And I think nurses definitely need to almost take a step back and go like, why are you doing all of this? Who are we doing it for? And I think sometimes we're so stuck in this grind, picking up that next shift, right? Like I just got to get home so I can just sleep and then make it to the next day, right? But sometimes it's so important if we can just find that little block of time and be like, let me take a step back and let me figure out where I'm going, why I'm doing this for, and who I'm doing it like with
Absolutely.
and for. I think with just within that self, I think nurses are able to really have a little bit more of that calmness and that
Yes.
groundedness that I think we need more in today's day and age, especially with the soft nurse era, right? So any last kind of like pointers or things to think about for the nurses who are grinding, who want to get fit, who want to start on their fitness, who want to just feel confident? Because I talk to a lot of nurses all the time, and a lot of them just want to regain their energy. They want to feel confident. They want to just be a little better. Like any kind of wrapping tips for our audience?
I would say you cannot show up for others if you do not show up for yourself. That may manifest into a mental health, an emotional health, physical health, that it will show up eventually. It will catch up to you. And let me just say it again, you cannot show up for others if you do not show up for yourself. And, whether it's fitness, whether it's nutrition, whether it's hydration, whether it's all of that, coping after a hard shift, whatever it may be, you have to recognize the areas that you're either lacking or need to take precedence over something else in order for you to be that effective nurse, in order for you to be able to balance life. From somebody who that hit me very early in my career and I was able to make that change, I can absolutely attest to that being truthful. And I would say 99% of nurses out there would agree with me. They just simply don't know how. So take it from the people who, specialize in that and are the experts in wellness to allow us to guide you on that journey, because we know the challenges, we know the issues, we know where there's lacking in our entire system. Let us help you. Don't be afraid to ask for that help.
I love that you wrapped it up with like, don't be afraid to ask for help. I feel like, you know, more more people need to hear that, right? And it's not a sign of weakness to reach out and get that support. So, I love that, you know, you mentioned that. And I just want to wrap up and say, Lauren, I appreciate you doing this interview today. I got a lot of value out of it. I hope our audience has gotten a lot of value out of it. We're going to have so many more series where we're going to dive more into nutrition, more into fitness and mindset. Yeah, like where can they find you? Because you're a critical care clinical instructor, you're a nurse educator, you do fitness, you're a trainer yourself. I mean, you know, where can they reach out to you and, uh, you know, kind of get to know more about you?
I'm definitely primarily on my Instagram platform. I try to post as much as I can to TikTok and Facebook, but honestly, Instagram has always been my happy space. So I'm on Instagram at Lauren Ignacio _. My fitness page is Lauren Ignacio Fit. So if you guys want to find me there, that's where I'll be. Feel free to ask me any questions, any tips and tricks. You know, I love talking with my community. It's always been a very positive space for me. So, you know, you guys reach out, and looking forward to being more on the show, because yeah, this is definitely very fulfilling for me as well. So thank you so much for having me.
Oh yeah. And yeah, guys, like coming from, you know, another fitness coach, just from talking to Lauren and just like watching her social media, she's legit. So give her a follow, check out her content, reach out to her. She's friendly. You know, she's a go-getter, but you know, she won't bite, as far as I know. And and if you're listening to this on the podcast, you know, would love to hear your takeaways. If you guys have anything that you guys want to know, like just hit us up, message Lauren, message me. We want to just provide a lot more value this year. And, you know, my vision with Team VP Fit is to continue to connect with amazing individuals in this space to really shine more light for nurses, for healthcare professionals, to be more fit, to be more healthy, to serve and to impact. And so if you're looking to really change your health and you want to work with us and you want to, you know, figure out what our program is for, reach out to me on Instagram. We'll schedule a strategy call, share with you more about our program, but we'll talk to you guys on the next one. Thanks, Lauren.
Perfect.